right, these notes are going to go into your HBS course file. All right, so this is my next sticky note, respiratory system. And so the function of the respiratory system is the exchange of gases, oxygen, carbon dioxide. Cellular respiration is when we take that oxygen and glucose and convert it into ATP. But the respiratory system itself, its function is just to exchange gases, get oxygen in where we need it, get waste product, carbon dioxide out. All right, an important piece of equipment for the respiratory system is the spirometer. It is used to measure lung capacity and lung function. So the spirometer is used to measure lung capacity / function. A respiratory therapist is a biomed professional that is not a doctor but certified to treat patients with lung issues. So a respiratory therapist is not a doctor but is certified to treat problems with the lungs, breathing problems. A pulmonologist is a doctor that specializes in the lungs. A pulmonologist is a doctor that specializes in the lungs. Okay, so we have the upper respiratory tract and the lower respiratory tract. Upper respiratory tract consists of the pharynx, the nasal cavity, nostrils, and the larynx. The lower respiratory tract consists of the primary bronchus. So we've got the branch there, so we have right and left primary bronchus, right lung, left lung. Alveoli, and so this is left lung, right lung, left lung. And the bronchioles. So upper respiratory tract, pharynx, nasal cavity, nostrils, larynx. Lower respiratory tract, the bronchus, those branches. The lungs, right and left lungs. The bronchiole, the alveoli. If we take a close look at the alveoli, we have a capillary that winds around it. Remember, capillaries are very thin, one cell thick. We need that because we need gas exchange to occur. So this is coming from the heart, and it's blue because it's deox blood. And as it winds its way around the capillary is filled with air that you breathe in. And so the air that we breathe in has a higher concentration of oxygen than carbon dioxide. Your blood has a higher concentration of carbon dioxide than oxygen. So these gases are going to move along their concentration gradients. Oxygen is going to go from where there's higher oxygen in the alveoli to where there's lower in the blood. Carbon dioxide is going to move from where there's more carbon dioxide in the blood to where there's less in the alveoli. This is a passive transport, so there's not any gated channels or proteins embedded or anything like that because carbon dioxide and oxygen are small enough that they can squeak through those thin little cell membranes that make up the capillary. So from the heart, and then it's going to go back to the heart. Gas exchange occurs in the alveoli. That's what we just looked at. Capillaries are a key component here. We need capillaries to encircle that alveoli. The conducting zone is the passageway for air to move in and out of the lungs. The conducting zone is the passageway for air to move in and out of the lungs. The respiratory zone are the bronchioles and the alveoli, and this is where gas exchange occurs. So conducting zone, I boxed this in, and then notice how the bronchi and the bronchiole are boxed in because they're, and the pharynx, trachea, larynx, nostril cavity, these guys are all, would help if you could see it, right? So these are all boxed in because these are all part of the conducting zone. Conducting zone is that passageway of air to move in and out of the lungs. Respiratory zone, that's the alveoli that we just looked at. Some important features of the nose. It has hair and mucus in order to filter the air and warm it. And actually, mucus also helps to add some humidity to it as well. So the nose is going to filter the air. The hair is going to filter out pollen, dust, debris, mucus. All that nasty stuff will stick to the mucus so it doesn't go down into your lungs. It also helps to warm the air and add a little bit of humidity to it. The larynx is also called the voice box, la 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 larynx, voice box. That's the Adam's apple that's very prominent in some people. And the diaphragm is also super important. So this is the muscle that actually helps us to breathe and allows us to breathe. Because our lungs don't have muscle tissue to expand and contract. So we need the diaphragm's movement in order to change the volume of our thoracic cavity, and that allows air to move in and out. So that diaphragm muscle, when the diaphragm muscle contracts, it moves up and into the thoracic cavity, and that's when you inhale. Moves down, whoops. Start over again. The diaphragm muscle, when it contracts, it moves down and expands that thoracic cavity. That's to help you inhale, so air gets pulled in. When that muscle relaxes, it moves up into the thoracic cavity, and that pushes the air out so that you exhale. So diaphragm contracts, you inhale. The diaphragm relaxes, you exhale. So we have an activity that we're going to do on the left-hand side. Let's do this stuff first. Okay, so you have a little insert. And this shows, as you take breaths, it shows the different volume of air that's moving. TV is tidal volume. And it's the amount of air in each normal breath. You inhale and exhale naturally. TV is tidal volume, and it's the amount of air in each normal breath that you inhale and exhale naturally. IRV is inspiratory reserve volume. It's any additional air that you can forcibly inhale. So when you take the super deepest breath that you possibly can. IRV, additional air that you forcibly inhale. ERV, expiratory reserve volume. So this is the IRV here, whatever you can forcibly inhale. ERV, whatever you can forcibly exhale. So ERV, additional air that you forcibly exhale. VC, vital capacity. Your vital capacity is your IRV plus your TV plus your ERV. Vital capacity, IRV, TV, ERV. RV, residual volume. That's the amount of additional air in the lungs that can't be exhaled. It helps keep the alveoli open. So kind of think of a balloon. So you blow up a balloon, let the air out. There's still some air in there. It's not completely stuck to itself, because if it is stuck to itself, when you blow it up too much and it loses its elasticity, that's a problem. Same thing for your alveoli. So there's a little bit of air that's left in there that help keep those alveoli from sticking together, helps keep them open. But you cannot exhale that. That's just something that's additional air that's in there, and it just stays in there. It's not anything that's going to help you with your respiratory rate or anything like that. All right. Total lung capacity, TLC, is IRV plus TV plus ERV plus RV. Total lung capacity, IRV plus TV plus ERV plus RV. Minute volume is the volume of air, minute. Minute volume is the volume of air that you breathe in 1 minute. This is without conscious effort. Minute volume, the volume of air you breathe in 1 minute, and that's without conscious effort. So minute volume, the equation for it is TV times however many breaths per minute that you take. So minute volume is your tidal volume times however many breaths per minute that you take. FEV, forced expiratory volume. So your TV exhale plus your ERV, this is a volume of air you can forcibly exhale. forced expiratory volume, your TV plus your ERV on the exhale, the volume of air you can forcibly exhale. FEV is used in lung function tests to diagnose and to evaluate how your breathing is. So FEV is used for lung function tests, used to diagnose and evaluate. So how are your asthma medicines working? Is your lung function deteriorating? Those are the kind of things that an FEV analysis can tell us. So FEV1, if the FEV1 is these levels, and it tells you about your respiratory rate. So if your FEV1 is above 80% or 80% and over of what is predicted, that means that that's your normal, and that's normal for you, and that's good respiratory rate. If your FEV is 60 to 79% of what's predicted, then that means you have a mild obstruction. If it's 40 to 59% of what's predicted, then you have a moderate obstruction. If it's less than 40% of predicted, then you have a severe obstruction. And I think that's it for now.